Welcome, Dr. Tanishq. Congratulations. Top 10 in
Thank you,
India.
sir.
How does it feel?
Uh, I'm very happy, sir. It's beyond expectation. I did not expect rank 10, so I'm very, very, very happy, sir, by getting
Great.
this rank, sir.
Super. Congrats once more. Tell us a little about
Thank you, sir.
yourself.
Sir, I did my MBBS from MGM Medical College, Indore, and my post graduation is from PGI MER Chandigarh. And I have completed my MS in September 2025 only. So it was my first attempt in NEET and INISS as well, sir.
Great. So, what are you? I mean, what subject did you take in INASS?
Surgical gastro, sir.
Surgical gastro. Great, great, great.
Yes,
So PGI, there is a tendency for people to go towards surgical
yes,
gastro. They're all
yes,
sort of like, it's a very fascinating thing in PGI and one of the best institutes for that. So great.
yes,
So tell us a little bit about your preparation. How did you start? How did
uh,
Dr. Tutorials and RRM help you in this?
yes, sir. So initially, I decided to go for an SR ship from PGI, but because of some reason, I wanted to give an attempt this year only. So from 1st of September 2025, I started preparing for NEET SS only because NEET was scheduled on 7th of November 2025. Later, it got postponed.
Yeah.
So then, yes, sir. So initially, I started watching videos of neurosurgery, plastic surgery, all peripheral subjects because I had some command over GS and GI surgery because it's a part of our training. So then the need got postponed. So from 1st of October, I started preparing for INISS. My main focus was on GS and surgical gastro only. That's it. So I got a CML 10 in INISS also, but my AML was 16. Then I again uh, switched over to the NEET SS preparation after giving INISS. So around 2.5 months I had for both NEET SS and INISS. So in that duration, I completed all the videos of GS, peripheral subjects, super specialties, and surgical gastro. And I religiously gave a grand test every week, sir. So that helped me a lot, and also the record videos that helped me a lot, sir.
Great. So, it's you are using any kind of preparation during your, I think you would not have had time probably. PGI is a very
Yes, sir.
hectic
No,
and
sir.
so
Yes,
you'll hardly have time for anything else. People literally sleep in the wards. I know I've had
yes,
friends who have done their MS from there. So you'll be living in the wards practically. You'll just use the room for coming, changing, and going half the time. So I guess this intense preparation, as you mentioned, PGI itself lays the groundwork for this because you learn a lot during your MS. And after
yes,
that, doc tutorials will kind of condense that knowledge and give it to you, and
yes,
areas
sir.
that you're not very familiar with, like as you mentioned, the peripheral subjects, a bit of
Yes, sir.
oncology, though oncology is there in this because gastro and general surgery is pretty much top class in PGI, but the others, some of them are there, but you may not really be exposed so much to them. So that helps
Yes, sir.
a lot as far as Dr. Tutorials is concerned, and I'm sure
Yes,
that the exams, the grant tests and everything helped you in a big way.
yes, sir.
Great, great, great.
Yes.
So where are you going to take it at your rank? What are the options that are available?
Sir, I'm taking guidance from my seniors, but my first choice would be JP Pant,
Okay.
and second would be SGPGI Lucknow,
Okay.
and third would be AIG Hyderabad. Yeah, I'm not sure. I'm taking guidance from my seniors and all the faculties regarding the college selection.
Yeah. Top three institutes. Yeah, I think one of these institutes you're definitely bound to get it. It's not a very difficult thing to get it. And all three are great institutes. Of course, GB Pant is the mecca of gastro. I still remember we used to come there for the examinations, and it used to be questions directly from semester. But that small point which you missed, that is the question that will be asked in the examinations. At that point of
Yes,
time, it all used to be, there was no neat SS kind of pattern. It was all, every exam was separately conducted by each institute, and we all used to write those examinations. I was interested in both gastro and onco, so I have a special liking for gastro still, and it was wonderful. GB Pant was one exam where the questions were from your basic topics, and still it was still going to be pretty good. That was the kind of thing that we had. So great, great, and I'm happy that you've gotten this rank. And any
Thank you, sir.
special thanks you wish to say for anybody, either from your family, your friends, your professors there, anybody in doc tutorials?
Yes. First and foremost, thanks to the Almighty, the great Lord Shiva, my parents my parents for their unwavering support because I did my preparation from home only. I am at my hometown only. And third, my fiance and my family, my friends in the PGI or the MBBS friends, my seniors, my professors at PGI, and whole doc tutorial team. Special thanks to the Raj Mahendran sir, Santosh Anand sir, and you sir. I must say that the your way of teaching the surgical onco, the tricks to remember those TNM stagings is really commendable, and because they are very tough to remember. The TNM stagings of oral cancers, skin cancers, cutaneous malignancy, and definitely 2 to 3 questions every year come from TNM staging. This year also it came. So thanks to the whole dog tutorial team, sir.
Great, congratulations. And who actually told you about doc tutorials? I mean, you started pretty recently, and it's a great
Yes,
feeling. Finished in September, by January you are into your dream course. So that's really
yes,
commendable on your part. As I continuously say, the candidate's effort is at least 80-90%, and we give the final push and the 10-20% from our side. So it's really commendable what you have done within a short span of time. And so, how did you hear about doc tutorials? And
from my seniors, sir. Because everyone, like you said, from PGI is more towards the GI surgery only. So I heard regarding dog tutorials from my seniors only. And I started preparing blindly. I had no idea about how the INI, because it is considered this that GI surgery in INIS is really tough competition. So I started blindly and religiously. I watched all the videos, not cubing because it is very vast to cover all the questions in 2.5 months. So I started giving that GTs, grand tests, or live and previous grand tests. So it helped me a lot. Also the INI recall sessions.
see, I'm sure that what you have done is really commendable and remarkable, because in 2 months to plan and do it takes a lot of specialized planning. You are very smart in approaching it. I remember what advice my senior had given me when I took up my NEET PG examinations. At the time, it was not NEET; it was All India. So All India examinations. He said, read the SAP subjects. I got it immediately after my internship. So during my internship, I was preparing, and he said, read skin anesthesia, radiology, pediatrics, psychiatry, all these things. You read, because those don't require a lot of effort. Questions will come
Yes,
from that, and it's easy to get
yes,
those answers. So you mentioned something similar in saying about neurosurgery, plastic, vascular.
yes,
All these
yes,
are sort of like, you may not get too many number of questions, but whatever questions are there will be reasonably standard. And so you attend any good faculty who's teaching, you will be able to get the basics of that, and that will push your marks to the front. And that is exactly what you have done. So for people who are looking for a short term preparation, first timers who have not been preparing, who want to get in, I think that strategy is wonderful. What you have done is excellent.
thank,
And then you also
thank you, sir.
sort of did the thing with, when you had that extra time, putting in the effort, like, it didn't get into your SRship. There are various ways. Some people do their SRship, they want to have a bit of training, and then they do that, also works. But when you're really pushing for it in the last 2-3 months, most people take the time off, sit down and prepare really hard, and that intense push is needed, because even though you've been preparing for a long time, that last minute, that push, that adrenaline rush is needed for you to get through, and that is what you've shown. So any advice to your
Thank
juniors?
uh, sincere advice to my juniors that work in wards. That is very important. You will the preparation can happen anytime at any time period. So don't worry about it. Just work in wards, gain clinical knowledge, and then sit and prepare. You will easily crack the exams.
Great,
That's
great.
a simple advice, and every coming generation is smart enough to prepare. So that's only advice.
So one question that I would like to ask you, if you had known about doctor tutorials during your residency, would it have helped you in
Yes,
your clinical field when you
definitely, sir. Definitely, but I had no idea. Even my seniors had no idea when they were doing ward works. So actually, in every college, we follow the tradition, what our seniors are doing.
yeah,
So they were
true.
not preparing, so I was not preparing. If they were preparing from some platform, so definitely I started reading, but I had no idea about any app or platform regarding the super specialty examination, because in the name of academics we did only journal clubs and mortality meets or presentation, that's only, and last 2 3 months we had for our final examination.
Correct.
So yes, definitely if I had time, so I would definitely take doc tutorials for preparation of my MS exams also.
That's a great thought because I don't think it may be possible in PGI. You can tell your juniors probably, but I don't know with the workload in PGI whether that will be feasible on a day-to-day basis. The only advantage you will have is like even when you're doing some other ward work or something, you can just listen to the videos and that will help.
Yeah.
And this I got the thought because many of the other candidates have mentioned that they took it during their residency and they were sort of just listening to the videos, not really. Some of them with a motive to prepare for their super specialty, some of them just to help them in their MS, and that has helped them a lot. PG, of course, is an academic institute, so what you mentioned as journal clubs, your mortality meetings, M&Ms, all that will go a long way. Many institutes may not have that, and that is where I think Dr. Riddles can fill the gap and lay the groundwork for you, basically. And
Yeah.
institutes, it automatically gets done in a lot of cases. But if you keep listening to those videos, that base work is already done, then you can switch over to the tests and everything, and that helps a lot, is my feeling. So maybe you can just tell your juniors, and they may, I mean, I was never thinking of that, but a lot of other students come and tell us during our live classes, at RRM's live class, and also doc tutorials whenever we go and meet, they tell us that it helps us in our exams as well. And for you, I would say that you have already gone through the material for INASS, not completely though. So that material
Yeah.
will be providing it to you, which will be helpful to you for your MCH wherever you take it, and it will probably
Sure.
help you wherever it is. It is going to be hectic. It's not going to be easy. Whatever MCH or DNB you do, it's going to be tough, and having a little bit of preparation will help a long way, and we'll be glad to provide it to you. So
Thank you so much, sir.
congrats
You
once
have been
more,
very
and
helpful and kind.
thank you for your kind words, and enjoy your time. You have
Yeah.
gone through a very hard phase of 3 years. Really, of course, it's an enjoyable thing. When you're a surgeon, you don't really look at the troubles. You look at whether you've enjoyed it, and PJ is very enjoyable. The ambience, the place, the sectors in Chandigarh. I'm sure you would not have gone outside the sector, but
Not
most of
not
you'll
many,
be
sir,
done.
not many.
You'll hardly
But
have
yeah,
time.
Chandigarh is a beautiful place.
It's a beautiful place. Just try and see the rose gardens and all those places before you come back. Because now you'll be at home, but maybe you can just take a little time to visit and see your professors and meet them and come back. And of course, spend time with your family as well before you jump on to the next one. It's not a really long time before you get the next seat and you move on. So all the best and congratulations. Please feel free to contact any of the Dr. Tutorials team, and we'll be there to guide you in your personal or professional life as always. Thank you. Thank
Thank
you
you
for
so much, sir. Have a
listening.
great day, sir. Thank you.
Thank you.